Varicocele is actually a dilated vein on around the testicular tissue. So, every organ is obviously gets a blood supply from the arteries and the blood is drained back through the veins. So if the veins which drain the testes, they become dilated, then what happens is that blood stays there for a longer time, and it can lead to increased temperature in the local area, which is obviously, you are aware, that is not good for the spermatogenesis process. So the reason behind that is that the veins contain the valve which pushes the blood towards the heart. And if the valvular function is disturbed uh, because of many reasons like prolonged standing, maybe overweight, or there is some genetic insufficiency of the valves, then the blood is not properly drained and it stays there and it can appear as a dilated vein. The patient can feel it or they can see it. Commonly, it is described as a bag of worms like feeling. Patient, if they specifically, if they stand for prolonged time, they could feel a dull, achy sensation in their scrotal, inguinal or scrotal area. And this can be further evaluated by clinical examination by a doctor to categorize the severity of that varicocele, whether it is mild, moderate, or severe, and whether it is on one side or both sides. Commonly, it is on the left side because of the anatomy of the left-sided vein compared to the right-sided vein. Um, and then you can also do imaging by doing testicular ultrasound scan. You can know about this presence or the severity of the varicocele. And that is the relation with fertility as well, that because the blood stays for a longer time, it generates heat and it can lead to sometimes it can have an impact on the number and quality of sperms.